Welcome to 630 Naperville. I'm Paige Ronchetti.
And I'm Nathan Ronchetti. We're so glad you could join us.
We've got a fantastic lineup for you today. Katie Wood takes us around downtown. We'll learn what to look for when it comes to skin cancer. Nathan will head over to Power Forward DuPage, and we premiere a new segment, Naper Bites.
But first, I'll be sitting down with Dr. Manal Ibrahim from Innovative Orthodontic Centers. Dr. Ibrahim, so great to have you on 630 Naperville. Thanks for joining us.
Thank you for having me.
So I'm a parent, and I'm always thinking about when I need to bring my child to certain appointments or be thinking about what they need. So how soon is too soon or not soon enough to bring a child to an orthodontist?
So it is recommended that every child at the age of 7 see an orthodontist, and that's just because their 6-year molars should be coming in at the age of 6. And then from there, we look at certain things that should be happening at different kind of benchmarks. So 7 is the most ideal time to do that.
So I still have some time, but I need to be thinking about it and get it planned ahead.
Absolutely, yes.
Excellent.
Yeah.
And so when I'm thinking about choosing a provider for braces or Invisalign, what sort of qualifications should I be looking for?
All orthodontists, when they go through their training, they get a degree called orthodontics and dentofacial orthopedics. So that's kind of like the baseline degree that we all get from the university that we attend. After that, you are able to become board certified. So you become a diplomat of the American Board of Orthodontics. And that is not mandatory, but if you do find somebody that's got that ABO qualification, that means that they have spent time taking this very challenging course, and you do have to renew it every 10 years. I think also when you find any provider, you want to connect with the person. You want to make sure that you have that comfort. You kind of see things the same way, and you do get that feeling inside that you're going to go along with this person on this journey. And I think that's part of the key to finding a great provider in any field, not just orthodontics.
So you feel like you're in the right hands and you're kind of on the right path together.
Yes, it has to be a right fit. It's a relationship. And so I think you get that feeling when it's right.
Excellent.
Click, yeah.
And so thinking about, what's new in the world of orthodontia, what kind of technology or changes are you seeing and you prescribe to patients?
We learn what we learn in dental school and orthodontic school, and we can just kind of keep doing that forevermore. But we do also want to take on great emerging technologies in our field because it does benefit the patient. And so there's so much great technology out there right now that's tried and true, right? We're not just experimenting on it. And I think finding a great provider has something to do with that. Are they keeping up with the technology? Are they keeping up with the standards of care in their industry? Yeah. And orthodontics has changed a lot because of technology. We now do have AI, so artificial intelligence can be part of our orthodontic monitoring. We have virtual visits, virtual care. We have vibration devices that help with tooth movement and give you a lot more comfortable tooth movement. There's so many different types of braces and different technologies today. So technology is incredible in the field of orthodontics.
Yeah, and not all braces are the same. So we might think about Invisalign versus more traditional braces, but there's some benefits there beyond the aesthetics of it.
Absolutely. I always tell patients, braces does not equal braces, does not equal braces. So finding a practice, again, that does invest in great technology in their bracket system is very important because it also can mean a lot more comfortable orthodontic treatment. Different braces have different ways of getting the wire engaged in them, which imparts the forces very differently onto the teeth and the type of wire that they use. So we have wires that are heat activated by the mouth. So they're constantly fresh and active. There's a lot of different ways that we can move teeth today. So technology is a huge part of it. And braces are different depending on where you go. And
we tend to think a lot about braces, being a teenager, kind of that period in your life, but there's got to be benefits to braces for any age.
Absolutely. We were talking a little bit about different bracket systems, but braces are not the only orthodontic appliance. So Invisalign is a great way to straighten teeth without having the actual brackets on there. And so the benefits of orthodontics for anybody of any age are far beyond just that beautiful smile. Yeah. So the health benefits of keeping the teeth straight so you can keep them healthy and clean, keep them flossed and brushed, keep them from having the usual wear and tear, that if your bite is off, you have a lot of wear and tear. You can get joint pain, clicking and popping. Also, it can affect the way that you eat food and digest. So if you're not able to bite into foods the right way, you might have an open bite in the front. You're not able to tear off the food and chew it properly, and so your stomach might have some issues from there. So the health and well-being of your body and your mouth has a lot to do with straight teeth and having a great bite, not just a great smile. And so we could use braces, we could use Invisalign for that.
So who would be a good candidate to have Invisalign versus more traditional braces?
And that's a great question, because traditionally, historically, Invisalign was thought to be more of just a cosmetic device. Meaning if you only had a little bit of crowding or a little bit of spacing and it was super simple, then you're a great candidate for Invisalign. But Invisalign today is a true orthodontic appliance. So anything that braces can do, Invisalign can do, as long as you go to a provider that has mastered the skill of using the Invisalign appliance, just like an orthodontist masters the skill of braces. If they haven't mastered the skill of Invisalign, they're probably going to tell you you may not be a candidate for it. If you are an experienced provider using Invisalign, a candidate for Invisalign is really somebody who's disciplined, because a lot of the work is put on the patient. And so when it goes to asking, is this a good candidate for Invisalign, it goes back to really the person's personality and how organized they are and how disciplined they are. If they're not very organized and disciplined, then braces are probably the better way to go.
And that kind of runs no matter the age. You got to be on that.
I would say so, definitely, yeah.
And so if I'm thinking about some other options, there are some direct-to-consumer options as well, but there might be some risks involved with those.
So those direct-to-consumer options, or DIY as we call them in our industry, really are not doctor supervised. And so I truly believe that anytime you're getting orthodontic care, you need to have a specialist, an orthodontist who's trained and who's an expert in their field, monitor your treatment and manage it to give you the right diagnosis and the right plan to get you where you need to go from a health perspective too.
And if you want to think about it, there's virtual consultation options as well that even you provide.
Absolutely, because we know that sometimes it's not convenient to keep going into the orthodontist for appointments, and so we do have virtual visits now that are remote monitoring, so that we can either have the patient scan their teeth at home once a week to tell us how they're doing. We use AI for that, and it helps the patient know that they're tracking well. It can also make sure that their hygiene is excellent. It can detect broken brackets. We also are able to connect virtually face-to-face with somebody, so we can see visually and have a conversation with them. And so orthodontics has come such a long way now to make it very convenient for patients to get the treatment without having to constantly drive to the office for those visits.
Excellent. Thank you so much for the time today. I feel so much better about what I got to do next and keep in mind for the future.
Excellent. Thank you so much.
Up next, Katie Wood heads over to the Now Massage for another edition of Around Downtown.
There are so many businesses you know and love in downtown Naperville. Today, we're here to shine the spotlight on one of the most relaxing places. Welcome to the Now Massage. So Carrie, tell us the importance of regular massage.
Some of the benefits of having regular massage, it relieves muscle tension, it improves range of motion, your flexibility, improves your mood, and definitely just overall.
So the physical benefits of massage then are some pain relief. So do you see a lot of your patrons come in and seek pain relief?
Yes, we have a lot of people that have like fibromyalgia, so they come in, or a lot of runners come in for leg pain, shoulder pain, all that stuff. And it definitely helps with all that. We have a lot of different enhancements to benefit that as well, like cupping. Cupping's great for people that work out or have a lot of tension in their neck from being on the computer all day.
Got it, got it. And some of the emotional benefits that you derive from having regular massage, can you touch on some of those?
So yes, anxiety, like I said, is like most people have. Mood swings, it helps relieve stress. All those are benefits to people now in this time of
chaotic times, right?
Yeah. So it definitely helps relieve those things, and they can move on and enjoy their families better.
Yeah, that's great. So tell us why you think it's so important for people to take the time to care for themselves regularly.
As you go day to day, life is stressful, and people make massage seem like a luxury. It's more of a necessity because it just helps you do your day-to-day things. You're not in pain. You can enjoy your children. You can bend down, things like that, things that people do day to day, and it hurts them, and it just relieves the stress from people.
Yeah.
It helps them so much.
That's great. I'm a believer. I'd like to work this into my monthly budget. Can you tell us or talk about some of the important things that are going on at the Now Naperville that we should know about?
I've worked at many places, and what got me to work here was the canvas drapery, the sound of the ocean waves, the open concept, the quietness. You're not allowed to talk. I've been at other places where they're just like chatting. I'm there to relax. I'm not there to chat with you. Yeah. So that's what I liked. So my clients are here. I massage them. They relax. They fall asleep. They come out with a massage coma.
Wow, that's a good way to put it.
So yeah, I mean, they enjoy it, and we have aromatherapy as well, so that helps with the relaxation.
Yeah.
It's complimentary.
That's great.
Yeah.
And so it's not only your massage, you could choose some enhancements. Can you touch about, I keep saying touch, no pun intended, but can you talk about some of the enhancements that you could get with massage?
So we have gua sha, that's like a scraping of the muscle. We have the cupping, which is a gliding cupping. So we glide it and we also place it. That helps with circulation. It helps with adhesions. It helps break them up. We have the fresh eyes. I love the fresh eyes because it's nice and cool. It goes on your eyes when you're face up, and it's just a nice touch to the relaxation.
That's great.
We also have prenatal glow, so all your mamas can come here and get massage and relax to have baby.
Good to know. That's very good to know. Okay. I mean, life is stressful,
Yes.
so massage is an important thing to help just relieve and just like take you away to a different place, right? If you come in here and have a 50 or an 80 minute, is that the length of the massage?
Yes, we also have a 2 hour and we have a 25 minute.
So you have many options.
Yes.
After the break, what to look for when it comes to skin cancer.
We'll be right back with more 630 Naperville.
Innovative Orthodontic Centers is the name of my practice, and we provide full-service orthodontic treatment to patients of all ages. We do a 3D scan of your teeth and your face, and from that 3D scan, we determine the most optimized position of your teeth, and we customize wires with braces. And if you want Invisalign, we customize trays for the patient. Technology has such an added value to the patient's treatment. It means that their teeth are going to be positioned in the most accurate spot. It also cuts down on how long you're in the orthodontic chair. We deliver unparalleled results: increased self-confidence, better oral hygiene, a more stable bite, a brilliant smile that hopefully will open a lot more doors for our patients. We love what we do, and we really treat all our patients like family. At Innovative Orthodontic Centers, we offer complimentary consultations. Visit our website or give us a call. I really look forward to meeting you.
Come explore downtown Naperville this spring. With over 100 shops, from national favorites to one-of-a-kind boutiques, it's the premier shopping destination in the western suburbs. Enjoy over 50 restaurants for dine-in, carry-out, and delivery, or relax at one of our many spas. For a night away, don't forget about Hotel Indigo, located right on the Riverwalk. Come shop, dine, stay, and explore downtown Naperville.
Hi, Dr. Basco. Welcome back.
Thank you, Paige. Happy to be here.
So first of all, let's, at the beginning, what causes skin cancer?
That's a great question, Paige. So you might know skin cancer is the most common cancer in the United States. 1 out of 5 Americans will develop skin cancer in their lifetime.
Wow.
So there's a few risk factors that I think we should all be aware of. And I'm sure probably most of the viewers are aware already that excessive exposure to UV radiation, whether it be it from sunlight or tanning bed use, is one of the main risk factors for skin cancer. Sunburns during childhood or adolescence increases one's risk for developing skin cancer later on in life. In fact, data has shown that more than 5 blistering sunburns will increase somebody's odds of developing melanoma by 80%, and for non-melanoma skin cancer by 68%.
Wow.
Other risk factors, we talk about genetics. Blonde or red hair individuals are at a higher risk. Also, having blue or green eyes makes you more susceptible to skin cancer. Certain ethnicities, like patients of Irish descent or German descent, are at a higher risk. Also, having a larger number of moles on the body increases your risk of skin cancer later on, primarily melanoma, as well as having family history of melanoma. A first-degree relative with melanoma increases your risk of developing melanoma later on.
So what are some things we can look for? What does the skin cancer actually look like?
Great question. So skin cancer does not follow textbook, and different skin cancers can look differently, but even the same skin cancer can look very differently in different individuals. We as dermatologists always will advise our patients to look for certain warning signs. Anything that is changing, whether it be growing rapidly, changing in color, changing borders, that could be concerning. Anything new, anything that bleeds spontaneously, anything that itches, an open sore that doesn't seem to heal, those are all concerning signs that you should see a dermatologist for. Now, there's different skin cancers. Basal cell carcinoma is the most common. Typically, we expect to see a pink sort of dome-shaped or raised bump that is translucent or pearly, often will bleed on its own and keep scabbing. A squamous cell carcinoma, that's fairly common too. Usually we think of that as more of a flaky pink patch that doesn't seem to go away. But sometimes it can also be a nodule or a growth, dome-shaped, raised. And then melanoma. Typically we think of melanoma as something brown or black, but that's not always the case. Melanoma can be light brown, medium brown, it can be blue or black, and occasionally may not even produce any pigment at all, and it can look just like an eczema patch, pink and scaly.
Wow.
So those are some of the signs, right, that we're looking for when we're looking for skin cancer.
Okay. So I see you have a device here. So tell me a little bit about this and what it's used for. I imagine this is something that you would use in your office if somebody comes in with a skin concern.
Correct. So this specific device is a Lumio. So this is very helpful to dermatologists. When you come in the office and we do a skin check, head to toe, we're actually looking for different spots, different lesions, and primarily for those moles. We're looking at the moles and making sure that they look healthy. Lumio is basically a magnifier. It is also a bright light, so it helps us see things a little bit better. Sometimes we'll use a dermatoscope, which can help a dermatologist to look at the pigment network within the moles. So these are helpful devices. Now, when we use the Lumio, right, so as we're looking at the different moles, we're looking for specific signs. And in fact, we as dermatologists, when our patients come into the office, we always remind them of a mnemonic called ABCDE of melanoma. And what that stands for is, A stands for asymmetry, so anything asymmetrical, right, that's concerning. B, borders, anything that has irregular borders, whether it be scalloped or notched, that would be concerning. C, color. Color should be uniform in a healthy mole, but if we do notice different variations in color, either different colors altogether or different shades of brown, that's concerning. D, diameter. Typically, we think of melanoma as something bigger, right? Bigger than 6 millimeters, but occasionally, or not infrequently, will we see melanoma that is less than 6 millimeters. And then E, evolution, which is probably the most important thing. That's just change. Anything changing over time, that would be concerning. So here, I'll show you a page. This is not invasive at all, so we're just using the Lumio to go up and down the body and then just examine the different moles.
Oh, wow. So like a giant magnifying glass.
That's correct.
So now that we know what to look for, let's talk about prevention. How can we help ourselves in this situation?
That's a great question. So it is very important to avoid UV radiation. As dermatologists, we always advise our patients to seek shade whenever appropriate. It is very important to maybe avoid sun exposure, especially during between 10 and 2 p.m., only because the UV rays are at their peak at that time. Very important also to wear some protective clothing, wide-brimmed hats, maybe sunglasses that have UV protection. And then anyone who's very fair, who's had a lot of skin cancer or burns very easily, it might be important to wear clothing that has UV protection. In addition, sunscreen, very important.
Yep.
We always recommend broad spectrum sunscreen, SPF 30 to 50, as well as water-resistant sunscreen. What is even more important is to remember to reapply sunscreen every 2 hours if you're going to be outside for that long, every hour if you're swimming or if you get in the water. And also, I do want to remind the viewers, it's just as important to wear sunscreen in a cloudy day as it is in a sunny day. And finally, very, very important to do those monthly self-skin exams to look for anything new, anything changing, or anything unusual. And if you do notice anything of that matter, please seek care by a dermatologist. See a dermatologist ASAP. Skin cancer, including melanoma, is curable if caught early.
Perfect. Thank you so much for all of that helpful information, Dr. Basco, and we appreciate you being here today.
You are welcome. Thank you for inviting me.
It's Electrical Safety Month, and electric vehicles, scooters, and outdoor power equipment are on the rise.
So I took a trip to Power Forward DuPage to learn more about what I should be doing to stay safe when it comes to the lithium-ion batteries that power these tools and vehicles. I'm joined by Karen Jarvat. So happy to be here at Power Forward DuPage. Thanks so much for having us.
Oh my gosh, thank you so much. This is definitely one of the most electric times
Yeah.
to be here at Power Forward DuPage. So thank you so much for coming out.
Yeah, it's a beautiful space. Do you want to start by telling us a little bit about Power Forward DuPage and what you guys do?
Sure. Well, we are actually in the home of the IBEW, Local 701, and we're actually a department within the IBEW Local 701 Union Hall here. And we represent about 350 electrical contractors and 1,500 union electricians here.
So pretty wide range there, all across DuPage.
All across DuPage. Some spill out actually into the collar counties as well, but primarily we are here in DuPage.
Excellent.
We also have our training center here. We are training the next generation of electrical workers through DuPage JATC, our apprenticeship training center.
And we're also joining you because it's Electrical Safety Month. So
Yes.
Can you tell us about that and the importance of electrical safety?
Absolute. Well, gosh, there's so much about electrical safety, but every May, the Electrical Safety Foundation International does a very focused and targeted awareness campaign to make sure that several key audiences are really tuned into electrical safety each year. They have different focuses, and this year we are focusing on really the importance of knowing how to store and care for your lithium-ion batteries.
Yes.
Now, do you know what these are?
I have some familiarity. I do an electric mower and I have an electric car, but I just feel like there's a bit more that I need to know.
Well, you know what? You're right on, because these are the batteries that power a variety of different consumer electronics, as well as, of course, our electric vehicles, electric mowers, and the newer e-bikes, e-scooters, if you've seen them around town. And they even store power in energy storage systems. So it's really important that people are caring for them properly. And in normal applications, these batteries are very, very safe, but if they become damaged or overheated, they can cause fires. And that goes back to the purpose of National Electrical Safety Month, is to be putting out information for consumers, schools, and local municipalities on the care of in this case, this focus is on the lithium-ion batteries.
And that's especially important too because we think about bigger batteries and then how they're built. They're different than batteries you might have thought about in the past, and e-bikes and scooters sometimes have these lithium-ion batteries.
Absolutely, they do. And the thing that I always want to just stress is people have been around these batteries for a long time, and they're just maybe now figuring out or hearing more about it. We like to serve as a resource as well at Power Forward DuPage, and we do have information on our website that talks specifically about some tips and care for these special lithium-ion batteries.
Excellent. So if I've got an e-bike or a scooter that's powered by an electric battery, what's a good way to be mindful how I'm storing it between use?
Some of the tips are to only use manufacturer-provided or authorized batteries and charging equipment. Always your equipment should be certified by a nationally recognized test laboratory. Very important. Also, remove the battery or charging device from the power once charging is complete. This will help avoid overheating. And this people forget a lot, but you need to keep those batteries and charge them at room temperature. Issues can occur below 32 degrees Fahrenheit or above 105 degrees Fahrenheit. And when we had that real cold snap earlier this year, right, there were a lot of issues. And I just kind of wanted to remind people, it's like with your iPhone, if you're laying out at the beach and you can't make a phone call, that's because the battery's overheated. Yeah. Same is on the other side of the spectrum when it's too cold. It can't take a charge. Anyhow, I digress.
And the benefit is the batteries are smaller, so you can take them off, and if they're in the garage charging, that's right. When it might get too cold or get too warm, you can pull them off and put them somewhere else.
That's exactly right. Also, you want to keep batteries and devices from other heat source, really, or anything else that could catch fire. That's huge. And you never want to store batteries in vehicles or in direct sunlight. Lastly, I would just say maintenance on batteries or e-mobility devices really should be completed by a qualified professionals, and that's where we can come in and help.
Thanks so much for having us here today at the Power Forward DuPage campus. It's beautiful. Appreciate you having us here and the time.
Oh, wonderful. Stop by anytime. We'd love to see you back.
After the break, we debut a new segment, Naper Bites with Chris Grano.
Stay tuned for more 630 Naperville.
We really see bread and butter dermatology like acne, rosacea, hair loss, warts, all the way to more complicated conditions like an autoimmune connective tissue disorder like lupus or dermatomyositis or an autoimmune blistering condition. In addition, I do provide surgical services, and that encompasses surgical removal of atypical moles, something as benign as a cyst or a lipoma, all the way to skin cancer. And then we do offer cosmetic services. Every patient who comes to Bosco Dermatology really feels heard. They receive personalized care. They will never feel rushed. See your dermatologist regularly. Even something that can look very innocent to our eyes, such as a pink bump that is completely asymptomatic, can actually turn to be a deadly cancer. Amelanotic melanoma can present just like a pink bump. And I have seen many pink bumps even in young adults. If there is one thing that I want to emphasize, it is go and see your dermatologist regularly, once a year to start with, and then more frequently if necessary.
Chris Grano, it's great to meet you. Thanks for being here.
Yeah, absolutely. Thanks for having me.
So tell me a little bit about yourself.
Yeah, so I'm a real estate agent here in Naperville. Live with my family in the southeast part of town. Have 2 young kids, been married to my wife for about 15 years, and just love everything there is to love about Naperville.
Well, it's a great town, so I completely understand.
Absolutely.
What is Naper Bites?
So Naper Bites is a celebration of the great restaurant culture that we have here in Naperville. I mean, anyone who lives here knows that people come from all over Chicagoland, and even nationally, Naperville has a reputation for a great town to live and have fun in.
Excellent, thank you so much. Let's take our first look at Naper Bites.
Yeah, I'm here at Billy Brick's Wood-Fired Pizza in Naperville, here with the owner, Rick. Rick, tell me about Billy Brick's. What makes your pizza special?
Here we do everything by hand, from making the dough to making most of our ingredients to stretching and then working the traditional ovens. One of the things that also differentiates us from a lot of others is that all of our flour and a lot of our ingredients that go onto our pizzas we import from Italy.
Okay.
So, if you know anything about those, there are no GMOs, no pesticides, very clean flour. So as you can see, we have very nice dough, ready to be stretched by hand and baked at a very high temperature.
So talk about the differences between New Haven style or Neapolitan versus like Chicago versus New York.
Yeah, so all it is a different temperature of the oven, a different bake time, and sometimes lower or higher hydration. The higher the hydration, the crispier your pizza gets.
Got it.
So that's another thing is we work with hydrations that are a lot higher than a Chicago style, a lot higher than other styles of pizza. Now, New York is generally pretty high hydration also because they're baking it low and slow, but they're usually mostly very different types of flour than what we use. So for me, it sits a little heavier, it's a little harder on the digestion, but it's definitely very filling and it's a style that I also enjoy. But it's not my personal favorite. This, I love the product that we put out.
All right, Rick, this is the new seasonal flavor, right? Tell me about this
It
pizza.
is. It's called the Sweet Heat. It has our garlic and olive oil base with our pepperoni, peppadew peppers with a little julienne basil and some fresh, locally sourced honey.
You think of like peppers on a pizza, it's usually like that very distinct pepper flavor. This is like fruity.
Most people are going to immediately think that the pepper is going to mean hot.
Yeah.
But it's slightly less spice than a jalapeno, so it's really not giving you the kick that's going to blow you away. Yeah. But it has a certain level of sweetness to it. It gives it a super unique flavor.
So, Rick, my biggest frustration is when I would go to a good restaurant, particularly like a pizza place, and I eat there, but then I gotta go somewhere else to get dessert, right? But I don't have to go anywhere else because you guys have all the desserts right here. So tell me about this ice cream sandwich. What's the ice cream?
So right here you have 2 1-ounce cookies, not the 6-ounce cookies.
Okay.
And then in between there you have our full scoop of exhausted parent ice cream.
Exhausted parent ice cream. So what's in that?
That has espresso beans with a hint of bourbon and chocolate chip chunks.
Wow. That's like real bourbon flavor.
That's real bourbon. This is an ice cream sandwich for Dad.
Wow. Appreciate it, man.
Thank you.
Everything was amazing.
Yeah.
All right, that's it for our time here at Billy Bricks. Join me for my next bite on Naper Bites.
Thanks for joining us here on NCTV 17. And now you know, from 630 Naperville.
I'm Nathan Ronchetti.
And I'm Paige Ronchetti. See you next time.